Dr. David, is there a lot of pain with the D5 implant solution, and what is the healing process?
You know, we know patients are concerned about how much discomfort this procedure will cause. So when we do the surgery, we totally sedate our patients. And then basically, again, it's about a 2-hour surgery. We're very careful to make sure, because it is a surgery, we want to make over the next 4 or 5 days when you're healing, we want to make sure you have adequate pain pills, and we make sure you do. When we do the digital records, there's no discomfort doing that. So again, you're basically going to come in for about a 2-hour surgery. You're going to be totally numb. You're going to be heavily sedated. Now, what I recommend to patients from doing hybrid bridges almost 30 years is I recommend that you take 4 days off to take it easy. So if you do the surgery Monday, you're going to come in, basically be in my office for about 4 hours. We want you to go home, and what's critical, put a lot of ice on your face. You literally, if you want to have a lot less bruising and swelling, if for that whole day until you literally go to bed, if you put as much ice on your face, get up in the morning until you come to our office about 2 to 3 o'clock the next day, ice again, it will dramatically, in most patients, reduce the swelling. Then basically you're going to get the teeth in less than an hour, and then you want to go home. A lot of our patients go back to work by Thursday if you'd have started the surgery on Monday, but almost everybody would be back to work by Friday. Now, when we say you're feeling good, the crunch day is usually Thursday. You'll come back and say, God, you know, I'm usually only on ibuprofen for pain relief by Thursday. It'll take basically about 2 full weeks before, if you go like this, where you're pushing where the bridge interfaces with your tissue, before you don't feel any discomfort. So again, we're very concerned and we're very careful to make sure you're comfortable during this procedure.
And the healing process?
Now, the healing process, it takes implants about 3 months to come up to full strength. So what makes the old teeth in the day procedure possible and what makes the D5 procedure possible is that we are splinting multiple implants together, and even though they're not at full strength, they share the load. And so the general rule of thumb for the first 3 months is if you can cut the food with a fork, you can eat it. So think about that. For breakfast, you can almost eat anything you're used to. You can eat any kind of cooked fish, chicken, even baby back ribs off the bone. Now, what you can't eat for the first 3 months are raw vegetables. You can't eat like raw apples. You got to be careful because the implants are integrating. Now, one of the unique things about the engineering of the D5 over the old-fashioned teeth in the day is with teeth in the day, you're converting with a flexible denture or some kind of printed restoration without a custom bar. One of the things, our implant company that basically almost spent a year looking at how we designed and engineered this restoration before basically telling every practice in the country that buys our implants that they should consider our restoration, is that we are going, and by the very next day, we're splitting the implants together with a final bar. Originally it was a titanium bar. Now we've re-engineered it with a material called Trilor that's even better. But what's happening is, instead of having a flexible temporary denture sharing the load, by going to the final restoration, this shares the load dramatically better than a temporary denture, so there's less chance of the implants failing. And so again, we basically have a 3-month healing period. During the first 3 months, you're on a softer food diet. After 3 months, when the implants are fully integrated, go at it for the rest of your life.